Before knee replacement surgery, you should consider your home environment as well as your family situation in preparation for surgery. And you should talk to your family members about supporting you for anywhere from 7 to 10 days, possibly even staying with you for a couple of days immediately after surgery to help you in the immediate post-operative period.
To prepare your home before knee surgery, there's just a few things that we ask you to do. One is to look around your home and see if there's any obstacles that are going to interfere with your ability to move around safely with either a walker or crutches, whichever device the physical therapist deems appropriate. Sometimes you may have furniture in a hallway or things blocking doorways into the bedroom or bathroom, and it's best to have those removed. We also recommend that you remove throw rugs from the floor or have them taped down as they're a tripping hazard. And just ensure that things like electrical cords are tucked back against the wall or behind furniture so that you're not at risk of tripping over them. You also should look at your stairs, make sure you have secure railings on your stairs. Another thing to consider is seat heights. After your knee surgery, it may be difficult to go down on a low surface or a surface that's kind of overstuffed that you sink down into. So looking around your home and getting a feel for surfaces that will work well to get up off from easily are something we have you do. Seat heights aren't as important for knees as it is for hips, but it is much easier to get off a higher surface that's firm or a chair with arms than it is to get up off an overstuffed sofa. So we recommend that you look around, get a feel for where you're going to be able to sit comfortably after your surgery. Following knee surgery, there are some devices that will help you with reaching. Initially, it'll be difficult to bend your knee, so doing things such as reaching down to don a sock or don a shoe may be difficult in those initial days. There are reaching devices that can help you with lower body bathing and lower body dressing if reaching is difficult. Those devices are a reacher, which can be used to help put on your pants, your undergarments. It can be used to hold a shoe in place while you slip it on. There's also a device called a sock aid, which is used to put your socks on. So if you're not able to reach down there and fully get that sock started over your operated leg, that will do it for you. There's also a long-handled shoe horn. If you have difficulty getting your shoes on, it can help you slide your shoes on easier. And lastly, there's a device called a long-handled bath sponge. So if you're unable to reach down to your foot or lower leg to wash it after surgery, this device will allow you to reach down there to complete that. Some equipment, bigger equipment, is there are risers for your toilet. If you're having difficulty here at the hospital getting up and down off a toilet and a riser might be beneficial for you, then we would recommend that at that point.
Once the recommendation for surgery is made and the patient decides that they want to proceed with total knee replacement surgery, sometimes it can be done as soon as within a couple of weeks. Sometimes it takes a little while longer to schedule it if they do need to see specialists, medical specialists, if they need to have a stress test done or if they need to have other evaluations done. It may take a little while longer to get it scheduled, but it can sometimes be scheduled within a couple of weeks, sometimes within 6 to 8 weeks, depending on scheduling and depending on when the patient prefers to have it done. Usually tell patients not to plan any major trips for a couple months afterwards, so many times patients will schedule their knee replacement surgery when it's convenient for them. Again, this is a quality of life issue. This is not life and death. Patients do this when it's convenient for them, and we try to accommodate that type of scheduling request. Before surgery, we want patients to be medically optimized. We want them to see and be evaluated by their primary care provider and perhaps any other specialist, such as a cardiologist, if they've seen cardiologists in the past. We want patients who have diabetes to be under as good a glucose control as possible. We want patients who smoke to potentially quit smoking for at least 2 weeks prior to surgery, because studies have shown that that makes a big difference on decreasing the amount of postoperative complications in someone who was a smoker. So basically get yourself ready for surgery as much as possible. If possible, to lose weight. prior to surgery would also help benefit healing and longevity of the prosthesis.
Critical portion of preparation for knee replacement or hip replacement surgery is dental health. You should not have any ongoing dental infection, any infection anywhere in the body. So if in fact you do have one of those processes happening, it is critically important to take care of this before an operation, because infection is very important after a knee replacement, and we want to avoid it at all costs.
To prepare for your knee replacement surgery, you want to strengthen the major muscle groups of the arms and the legs. You want to start out with doing some arm raises or elbow curls, and you want to work on doing some leg raises. That's raising your leg off the bed, keeping your knee straight.
Before surgery, patients need to report directly to the registration desk area. From there, they will be taken directly to the pre-admission testing area.
In pre-admission testing, the patient has an interview with a registered nurse. At that time, they may have a chest x-ray, an electrocardiogram. They may do some blood work there. They need to bring in a list of their allergies and a list of their medications, including what the medicine is, what the milligram is, how many times a day they take it, who the physician is who prescribed it, and the pharmacy's location and phone number, so that if they need to prescribe medications, they have that.